In 1854, this guy, Aristide Augustus Stanislas Verneuil, was frustrated by the lack of literature on skin tumors, and he wanted to do something about it. So, for the next 11 years, he published a series of articles on the subject. One day, he was examining a cadaver of a patient when he noticed inflamed nodules around the sacral and gluteal regions. He made detailed notes about his observations. For example, at one point, he said, "After removing the epidermis, the cleaning of the pustule made perceptible a tiny red hole, in which one could introduce a bristle of a boar or very thin stylet. Then one entered a channel of 1/5 to 1/3 millimeter crossing the dermis and leading to the subdermal cavity larger than the subepidermal one." He concluded that the condition was caused by decomposing sweat glands underneath the epidermis of the skin. Verneuil would go on to name the condition hidradenitis phlegmones, which would eventually become hidradenitis suppurativa. This is what hidradenitis suppurativa looks like. It's a chronic inflammatory skin condition that presents with painful pustules in the skin folds. It turns out Verneuil wasn't completely right about how the disease worked. And honestly, researchers are still trying to figure that one out themselves. But here's the current working theory. First, the skin cells in the sebaceous gland, infundibulum, and the isthmus regions begin multiplying faster than usual. This clogs up the follicular duct, eventually sealing the hair inside. As the hair continues to grow, it can't move up and begins putting pressure on the surrounding cells. As these surrounding cells get squished and stretched, they become damaged. This initiates an immune response leading to inflammation and swelling. Now, if the immune system isn't able to fix the follicular duct, it can rupture. Bacteria, sebum, keratin, and other bits of cells can then leak into the surrounding tissue. And this, in turn, causes an even larger immune response. With time, the immune system can usually get things under control, allowing the follicular duct to heal. But one of the defining characteristics of hidradenitis suppurativa is that it reoccurs, often in the same spot. The more this happens, the more likely long-term skin damage occurs. Permanently dilated follicle ducts can occur, which look like little holes in the skin and are called tombstone comedones. Fibrotic scarring, as well as tunnels under the skin called sinus tracts, might also occur. Occasionally, the immune system won't be able to repair the ruptured duct. In these cases, it tries to quarantine the leaking duct by surrounding it with macrophages, which is a type of white blood cell. This is called a granuloma, and you can think of it kind of like the immune system treating the area kind of like a hazardous industrial accident. Early diagnosis may help prevent the disease from progressing. Early treatment helps prevent future episodes, and therefore less permanent damage can occur. A diagnostic framework such as the modified Dessau definition can be used. In this framework, healthcare professionals should look for the following: deep, painful nodes or lesions with scarring, tombstone comedones or tunnels, lesions presenting in the skin folds of the body like the armpit, groin, perineal areas, as well as under the breasts, and lesions reoccurring twice or more times within 6 months. Asking them questions like, have you ever had any outbreaks of lesions during the past 6 months? For each outbreak, were there at least 2 lesions? And were the lesions in the axilla, groin, genitals, under the breasts, or were they somewhere else? Will help you make a diagnosis. Or if you'd prefer, there's a visual questionnaire by Casaniga et al. That you can give the patient. We've left a link to it in the video description. Diagnosis is based on the patient's history and their presenting symptoms. Other diagnostic tests like imaging or biopsy aren't usually done unless the healthcare team has a specific question, like if they need to differentiate from squamous cell carcinoma. The severity of a case can be categorized using the Hurley clinical staging system. These stages are pretty straightforward. Stage 1 is the presence of one or more of the deep nodules. Stage 2 is reoccurring nodules with sinus tracts or fibrotic scarring, with one or more clusters of lesions on the body. But the clusters are separate from each other. Stage 3 is like stage 2, but there are more clusters and they are interconnected with each other. It's not really clear what causes hidradenitis suppurativa. It's being suggested that there's a genetic link. Up to 40% of people with the condition do have an immediate family member with the disease. Smoking, obesity, and changing hormones could also cause the condition, but these hypotheses are speculative, and no clear cause has emerged to date. That said, we do know that it affects women 3 times more than men, and it occurs in around 1% of the population. Symptoms usually first appear in a person's 30s and 40s, but can occur as early as puberty. Treatment is based on the stage of disease. For mild cases, use topical antibiotics like clindamycin, as well as oral painkillers and warm compresses to reduce discomfort. If that doesn't work, try oral antibiotics like tetracyclines. Anti-androgen drugs like spironolactone are also commonly used. For moderate cases, consider using intravenous antibiotics, punch debridement, topical resorcinol, and injections of corticosteroids into the nodule. Don't cut and drain the lesion unless you need to relieve pain immediately. The lesion will probably just reoccur. For severe cases, you may need to use immunosuppressives or consider surgical treatments. So, in summary, hidradenitis suppurativa is an inflammatory skin condition that affects the skin folds of the body. Hair follicles get trapped in their pores, which causes painful inflamed nodules, skin tunneling, and severe scar formation. The underlying mechanisms causing this disease aren't well known. It typically first appears in someone's 30s and 40s, and the disease affects women much more than men. Healthcare professionals can diagnose the condition by following the Dessau framework and by asking patients specific questions about their experiences with the symptoms. Treatment includes antibiotics, anti-androgens, steroid injections, and surgical treatment depending on the severity of the condition. Thanks for watching. As a reminder, there's thousands of real-world medical cases on Figure 1. Visit us and sign up so that you have access to the most valuable and interesting medical cases to help sharpen your clinical skills.